Committee Member Krueger.
Thank you, Chair, and thank you for sharing your knowledge. It's a bit overwhelming this morning in that we've had 3 presentations now on such dire needs that are in the public, and it's just kind of mind-blowing at how much need is out there, and I'm not seeing an end because of the proliferation of the drugs. But I'm wondering, in your practice, are your appointments like boom, 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 constant, or is there a lag, or is there so much need for this service out there and these kinds of services that you can't keep up?
Yeah, thank you for the question. Yes. So currently, the data has shown that only 22% of patients with opioid use disorder are in medication-assisted treatment. So there are still 78% of patients who do need treatment. And they are not receiving any services at this point. So I believe there is a huge need to open new clinics. There is a lot of patients do need these services. Did I answer your question, or
yes,
the second part?
Yeah. So it's just kind of interesting, and I sit back and I'm like, okay, what are we doing about the drug proliferation? I mean, how is it that it's just why are we not stopping the drugs from getting here? I don't know if you have any thoughts on that, or you're having to stay focused on what your specialty is. But if I'm just not finding relief in all of these programs, that it keeps growing.
No, I understand. That's not part of my specialty. However, I can go over one thing and explain something. Is addiction is a chronic disease. It is not an acute ailment. When a person is just like diabetes, the best example to explain addiction, opioid addiction, is diabetes. It's a lifelong disease. Once a patient or a person has addiction, there are actual structural changes in the brain, just like diabetic has in pancreas, or a patient with heart failure has it in their heart. So it is a lifelong disease. It is not ever going to get better. That's one of the myths I would like to break here. So if a person has opioid use disorder and they have the chronic opioid use disorder, they are going to have it for the rest of their life. And they are going to need medication, just like a diabetic or a hypertension, for the rest of their life till they die. That needs to be understood. It is not an acute ailment. So that is one thing. So again, having a program. So let me explain it this way. So the best way to manage a chronic disease is with lifestyle modifications, behavioral therapy, and support from family and friends, right? So, for example, if someone has diabetes, what is the best way? Ideally, the person loses 30 pounds or 40 pounds of weight if they are overweight. Type 2 diabetes, I mean. At work, co-workers are not bringing donut. He's going to sneak one in. In the refrigerator at night, there's no cake there. When everyone is sleeping, they're going to get one, right? So the support from family and friend is needed. Similarly, behavioral therapy. So a diabetic does need to go through a diabetic education program. Similarly, with opioid addiction, it's the same model. We do need the counseling, the outpatient treatment, inpatient treatment, just like a diabetic educator. They do need to understand. But tell me, how many of your family, friend, people you know who are type 2 diabetic are not taking a medication, and with just lifestyle, they are managing their diabetic? I don't know any. I'm an internal medicine physician. All my patients are at least on metformin. All my hypertensive patients are at least on lisinopril. Similarly, with opioid addiction, patients do need medication, and they are going to need it for the rest of their life. So when someone has opioid use disorder, buprenorphine is just like metformin on lisinopril. And the patients who do not get improved, then just like I would start insulin, I will move the buprenorphine patient to methadone. and keep them on it, just like I would keep a patient on insulin for the rest of their life. Similarly, again, if I have a patient who takes a donut, or if a diabetic takes a donut, he relapsed. Should I decrease their insulin? Should I cut down on their metformin? No. I'm going to increase their insulin. So the expectation that if I have a patient in my clinic who relapsed, I'm not going to cut down their medication or create more barriers for them. We should help them. And that's the model we are moving forward with. So previously, methadone clinics, the word has stigma and taboo to it. What happened was the clinics were very few in the state. Very few clinics were available. There was a 3-month waiting time to get into these programs. Patients had to come every single day to get their daily dosing. And there were lines outside the methadone clinic in the morning. You go there at 5 o'clock, there are 100 patients outside. Things have changed. Especially post-COVID, it is not the same anymore. So the SAMHSA and the state have relaxed the rules around it. So it's now on the physician's discretion, even on day 1, they can give the patient 7 days of take-homes. And after 7 days, they can give them 14 days of take-homes. We do not have to follow a rigid that, nope, you have to come every single day to the clinic. So they are more like any other specialty clinics. Now, and that is the reason why the Northwest Integrated Health in our program, what we are trying to do is bring the treatment to the patients. Instead of having 2 or 1 or bigger programs, just create it in the neighborhood clinics where 50, 100 patients walk in, just like in an hour, 2 or 3 patients are seen. They get their medication, just like any specialty clinic, and then they can go home. Also, now our assessment, counseling, we can do those remotely. It is allowed. Similarly, even the medical visits can be done remotely. The patient has to be at the clinic. However, in the medical visits, the provider does not need to be at the location. They can provide remote. That has helped us also in opening clinics, because I do not need to have a clinic present, a provider present at each clinic at all times of the day. So, there are some, there's better understanding, there is better rules from the state and the feds, and it is helping. It definitely is. It's more scientifically being treated now.